walking outside, looking at the TV, looking at your computer screen, looking at your smartphone. You probably are seeing people with masks on to prevent them from inhaling or exhaling specific germs to spread contagious viruses in today's events. It's a challenge because the question of not only how do I prevent having this thing, the question also exists, how do I pay for myself if I do have this thing? Healthcare, and more importantly, health insurance, is a huge issue that faces specifically Americans, but it faces everyone in the world. And the debate, the question is, how do we pay for it? How do we handle it? Today, the guest is Maria Overcash. She's a health insurance expert, and she's going to give you some information about the industry and how to maximize what you're getting when you get a health insurance policy. She's going to give you a lot of good information, so make sure you pay attention and take advantage of this time that we share our voice with each other so we all can benefit. So, without any more hesitation, let's go. And today on Voices, I think this is probably the most appropriate and timed podcast that I've recorded since I started, specifically because of the issues that are in the world right now. Today joining me is Maria Overcash. She is a health insurance expert, and she is going to give you some breakdowns about several things in the health insurance industry. And it'll be really vital to listen. And if you do take notes, definitely this is one I would want you to take notes on. And so thank you, Maria, for being here. No person can introduce themselves better than themselves, so I will leave the floor to you.
Thank you. I appreciate it so much, Lou. I got into health insurance in 1996 because I was trying to get out of retail, and I landed a position working for an insurance company, Cigna Healthcare. And when I was there, one of the things that frustrated me more than anything was taking phone calls from customers who did not understand their health insurance, because the agents just came in and said, pick a plan, sign up, and walked out the door. So after 10 years of working for Cigna, and after having a personal battle with cervical cancer and beating it, I decided it was time to make a change in my life and start helping people on the other side as an agent, where I could really sit down and do education and let them truly understand what type of insurance they had. And through the evolution of change, I ended up setting up my own agency, Carolina Health Connections, here in Fort Mill, South Carolina.
And we met probably 5-6 years ago, and it just the amount of information that you were able to provide to me was really great, specifically because I was in a different insurance. And so my first real question is, why do you think health insurance is considered to be one of the most complicated insurance industries in the States?
Well, I don't know if it's necessarily complicated, but the more the government gets involved in legislating and controlling and putting requirements onto the insurance companies, that's probably where the biggest form of complication comes from. But it's complicated when you get to Medicare, because you got Part A, Part B, Part C, and Part D, and then you have Medicare plans and Advantage plans, and that's a really complicated thing. But a standard health plan where you can just, when you're under 65, you get an insurance card and it covers doctor's visits and hospital and testing, that's not as complicated.
Okay, and so you bring up the government specifically, and I think that's a really important thing. Now, the ACA, the Affordable Care Act, as you informed me, which I didn't know, it's about to reach its 10th year anniversary. Now, when that act came out, I'm being given my personal opinion, I saw it as a jobs program, especially what they ended up kind of turning into. I didn't see it as necessarily a bad thing, but I just saw it kind of as a jobs program and a way for insurance companies to require people to have insurance. So what's your opinion of how the ACA was rolled out and its implementation so far?
Okay, so, and again, the Affordable Care Act actually turns 10 years old on March 23rd. I think the initial rollout was very chaotic, and we spent way too much money on a government website that we didn't need to. We could have brought in, we had military personnel that are incredibly trained IT people that could have created the website for $100,000 or less. So the first year was crazy. I lived through that and 2 months of nothing working right. But now that they've gotten it out, once we got the bugs worked out the first year, it's been very, very good for those who could not afford health insurance. I don't see it really as a jobs program, as in helping people like wait staff, hairdressers, people that had low income jobs where their companies weren't offering health insurance, to be able to roll out an affordable option for them. And it's helped a lot of them. I've got people, stories of people that are insulin dependent diabetics where the state didn't there was no Medicaid for adults. And it was allowing them to finally get that they needed. But the bad part, that flip of the coin, was because of the heavy government regulations and requirements, the rates have tripled. So the middle income wage earners took a big hit. They really suffered, because when you were paying $700 a month for a family of four, and now it's $1,500, $2,000 a month, all of a sudden they can't afford it. It made it unaffordable for the middle income. So we're always looking for alternative ideas and programs and ways to help them.
And so with that, and I mean, again, just because I looked at it as now I do agree there are there were really good benefits for other people for who couldn't get it afford, because like pre-existing conditions was one thing that I thought was a pretty good thing that was on there. So what are some of the highs and lows of working with insurance companies now that the ACA is there, and maybe some things that could possibly be improved or you've seen improved down the line?
Okay, so go back to when it first rolled out, the legislation. We had a lot of health insurance companies. We had a lot of small ones. And we've got 5 or 6 key, very large national health insurance companies that you're all familiar with. And what happened with the small ones is they either re-geared and left the health insurance altogether, sold out, or just shut their doors. So we went from having, on average, most states had at least 10 to 15 insurance options to 3 to 5. So that was a big killer, because the goal was, the federal government rolled out co-ops. And co-ops were supposed to be nonprofit, give us options other than the health insurance companies. They were a colossal failure. Almost all of them imploded within the first 2 years. We as a company paid over $1 trillion to roll them out, instead of taking the small carriers and helping them. They already had the infrastructure and the process to start with. And like I said, almost every one of them has imploded and gone away. It's just a huge, colossal waste on that part of it. Now, getting into this program, this is the 7th year of the tax credits. By year 4, the insurance companies, the first 4 years, they lost money doing this. The first 3 years was a definite loss of money. Insurance companies were bleeding money. Everybody left except for, as you'll know, Blue Cross Blue Shield, because most of those are individually owned and operated in each state. They just share a global association with each other. So they had to hunker down and be the core that kept this program alive, which they've done. And I'm thankful for that, because otherwise we wouldn't have individual health plans. But now that we've turned the financial corner, we now have new small insurance carriers that are popping up, that are coming to life. North and South Carolina added 3 new insurance companies for 2020. The good, bad, and the ugly. And now we're seeing which ones are going to survive. And my perspective, if they've got a strong network and they're building a good network and they're paying their bills, they're going to survive. If they chose to roll out without actually being boots on the ground and getting doctors and hospitals contracted, they're going to collapse. They're going to fail. because people don't want to get an insurance policy and have to keep changing their doctors or fight to find a doctor or specialist that's in network. They're tired of that fight.
And the thing that you're leading to a little bit for me is obviously health insurance can be improved. And so what do you think are some things that either will be implemented, hopefully, to improve either policies, systems, etc., that either you hope will be implemented or that you would suggest that may help not only the insured, but the insurers?
Well, it's hard to say what I hope they will implement because um, it's a constantly evolving and changing industry, and I can have a lot of hopes and dreams, but that doesn't mean they're going to happen because I'm at the point of where I work with the carriers and I help the actual individuals to be able to get the insurance. I don't have the input or influx to be able to make any significant changes. That's not saying that I don't try. I do talk to my insurance carriers. I say, look, this is broke, fix it. I have no problem reaching out to our senators and our congressmen, our House reps, to let them know that something's broke, fix it. And that actually opens up what's broke today with the coronavirus going on. What's broke today is a lot of small businesses that are offering group health insurance that are literally running their business operations month by month, cannot afford to pay the premiums if they have to shut their business down, which with this epidemic we're currently going through, a lot of small businesses, restaurants, daycares, private schools, they're having to shut down for a couple of weeks. They can't afford it. I've actually reached out to our congressmen and our senators and let them know that with this bill that you're trying to pass for aid, you need to pay the health insurance premiums for a month. Just pick up 1 month of health insurance premiums so that the business owner and the employee doesn't have to pay for it, and to allow them to be able to still keep their health insurance while we're going through this craziness.
And you know what's interesting is that not to delve terribly into politics, but there's obviously the system out or the talk about having Medicare for all or a single payer or having some form of socialized healthcare. And so, what is your opinion of that? What is the information you have sort of on as a background to say how do you think it would be implemented if it could or if it could be implemented in the states?
So I go back to where socialism started and where the socialized health insurance that we think of was originally founded, and the country that created it all. And we're going back to Karl Marx and Frederick Engels and Germany. And Germany has an amazing healthcare system, and it's constantly being touted as the best system. What most people don't understand, and I learned this recently from a client who's lived in Germany for over 20 years and ran a business in Germany, and that is you can still purchase private policies individually. And if you have a company and employ people, you are required to offer them private health insurance and pay 50% of it. The biggest thing in Germany is that they don't have a million layers of government intervention that requires crazy things in it that don't need to be there. So their health insurance is affordable. It's like we used to pay before this legislation. And they don't have $8,000 out of pocket. So they took the best programs and put them together. They still keep private pay. So when you think it's all Medicare for all, it's not. Denmark's the same way. The countries that have the best medical systems still allow for private pay insurance, but they also have the government insurance. So it's a combination that makes it work.
Well, what's interesting is that sounds a little bit like, not exactly, but a little bit like how the U.S. government subsidizes farmers, so it can be competitive in the world. I guess the biggest difference is for healthcare, it's not on a world market, so the healthcare providers in the United States are not trying to service people in other countries, but farmers are trying to sell their goods to other countries. So I can get that. I mean, that sounds interesting. as an idea. And I do wonder, and I hope that, someone is able to sort of articulate it, but similar to how you did, so people can probably see it as a desirable option. So another question is, and you kind of alluded to it a little bit, is what are some systems that are helping the industry right now? What are some systems that maybe need to be eliminated or can be improved so this system can run a little more fluidly? Because I know a lot of people have issues with dealing with or understanding their health insurance in general.
I'm going to actually recommend people take a little bit of a break and take a watch of a little video out there. There's a comedian, and he did a show for a couple years called Adam Ruins Everything. And if you look him up and look up Charge Master, you will begin to understand what's going on with healthcare costs. He explains the evolution of health insurance and how hospitals are now the ones dictating how much insurance companies have to pay, and that they created a Charge Master, which is literally a magical book that has no financial factoids behind it to actually say, why would you charge $500 for 2 aspirin? But they do. And I think it's a really good video to watch. It's about 10 minutes, but it explains how things changed, because the hospitals for a long time were losing money and were closing. And about 20 years ago, they realized that if they got the doctors to contract under them and they put multiple hospitals together, they then controlled how much the insurance carriers had to pay them, instead of the insurance carriers negotiating a discount on what it actually cost. They now negotiate a discount on an artificially inflated plant rate. So if it costs truly $1,000 a day to be in the hospital, they're telling the insurance companies it's $3,000 a day for them to be in the hospital, and we'll take $1,000 a day discount. So they're making huge profits now and controlling the industry. And what people don't realize, and Adam Ruins Everything really does a good point of this, is that when you pay $2,000 a day for something that should only be $1,000 a day, that money comes from somewhere, and it's your insurance premiums, because you have to pay for it ultimately.
Right. And the interesting is I actually saw that. That was part of the reason why I was inspired to invite you to do this. And so I learned about the Charge Master. It was interesting because I was on YouTube looking at videos, and there was a connected video where there was a doctor that replied and said that he was fear mongering. But then when you watch the whole video of the guy, he agreed with almost everything he said, which I found kind of interesting. And so one of the arguments he did make, which I think it has a degree of truth, is the profits that hospitals will say they need those profits to finance R&D, research and development. And while I get it to a degree, but I'm like, it's the inflation of it is, I think morally, I don't know if that's morally wrong or not, but I would classify it sort of as morally wrong.
Well, so here's kind of the coolest part about this, and most people don't realize this. Go Google what your executives make at your local hospitals. In the Charlotte area, the Charlotte Observer has a reporter that every year goes and pulls the financial documents, because they have to turn in all of those numbers by the end of January. So they're out there probably now, and it'll show you what the executives all make. And when executives running 30 or 40 hospitals are making $7-8 million a year, and here's the kicker, they're nonprofits. So they're not paying taxes either.
Well, I'll move past that, because that deals with what politics, so to speak, on that one.
But yeah, you're right. I don't want to get into which side is which side, but at some point in time, we need to go back to, how did they become a nonprofit? Most hospitals were started by churches and have sold out. And they were nonprofits because they were taking Medicaid patients and low income. And things have changed. And should they keep that status? And you're right, that's a political question. But I don't think our politicians are even looking at it. It's not something that's even hit their radar.
Well, and you brought up a point that I think is worthy of discussing, is like who actually turns the profit when we look at this, because the narrative in the news is that the insurance companies are always turning the profit, but there is a triangle of how this works, of insurance companies, hospitals, pharmaceuticals. So in that equation, who actually is turning a profit in this health insurance situation for individuals?
So the bottom line is they all turn a profit, but we need to look at the amount of profit and the percentage of profit that they're pulling off of it. The Affordable Care Act actually legislates that if you're a small business or an individual policy, the insurance carriers cannot make more than 20% profit off of a policy. So if your policy is $500 a month, the insurance companies cannot make more than $100 a month profit off of it. Then why are they not doing that same regulation with the pharmaceutical and hospitals?
Uh, Again, that's definitely politics. So it's sort of down that rabbit hole of how do you work that. And so helping the individual directly, because you advise individuals, when advising individuals on choosing or building a health insurance plan, what are some of the essentials that they should have in order, or they need to do to get the best bang for their buck?
So I look at a couple of things. And the first thing we look at is their personal income, because we actually want to allow them and try to help them get the tax credits through the Affordable Care Act to control their health insurance costs if they're eligible for it. And that's important because I'm going to give an example. So say I'm dealing with a waitress and she makes $15,000 a year. Her tax return shows she makes $15,000 a year. She's going to get a health policy for somewhere between zero premium to about $100 a month, depending on which plan she wants. And we look at the plans and say, we look at the deductibles, the co-insurance, the co-pays, and the out-of-pocket. So this is going into how do you understand the difference. So a deductible is the first dollar you have to pay, depending on the services, and it spells it out in the policy before the insurance company starts to pay anything. So let's say you've got a plan with copays for doctor's visits and prescription drugs. And it says you pay a $30 copay for the primary, a $60 copay for the specialist, and then you have prescription drug copays. Those are what we call copay plans. And you're not going to meet your deductible first. You're going to just pay your copays to go get your services rendered and to see your doctors and to get your drugs, which is important because our deductibles and out-of-pockets have gone through the roof. If we thought the premiums went up, the deductibles and out-of-pockets have gone up even more. So those are good plans for the average person who's not making a lot of money. They just want to be able to pay a few bucks and be able to see the doctor and get treated. Then that plan may also have a $6,000 deductible. So then you're looking at things like MRIs, CAT scans, surgeries, hospitalizations. Those are going to hit your deductible. After you meet your $6,000 deductible, you may have a 30% co-insurance that you have to pay, and the insurance company will then pay 70%. And the new max out of pocket for 2020 is $8,150 for an individual. Everything you pay of covered services, your copay, your deductible, and co-insurance all contribute to that max out of pocket in a calendar year on an individual plan. Once you've met that max out of pocket for covered services, the plan then kicks to 100% for the remainder of the year. Well, someone making $15,000 a year may get a free plan that covers like that, but they can't afford it. You know, if
Right.
they're healthy and they're young, they're going to take the plan that has it's not really free. It's a zero premium because you got tax credit to cover it. A lot of them will take that plan because they want to make sure that they can just go to the doctors. But if I have somebody who's 50 years old and has health issues, they may be willing to pay $125 a month to build that same income level so that they can get a plan with an $800 max out of pocket for the year. instead of an $8,000 one. So you have to look at it on an individual basis as to what plan fits your personal needs. If you don't go to the doctors much and you're healthy, you're going to take the less expensive. If you go to the doctors and you're worried about medical bills, you're going to take the one that has a lower out-of-pocket cost and pay a little bit more in premium. So we actually sit down and educate and go through the plans and the options and explain to people the plans and how they work and check their doctors and explain what doctors are in network with the plans, because that's been a huge thing with the Affordable Care Act, is the networks that got changed. And we're starting now to get better and better networking structure, and we've got some decent networking structure. The first 2 years were crazy. And that's a concern as the new insurance companies are rolling into the industry and coming out. We got new companies coming in. I tell everybody, before you change insurance companies and you know your doctors are already in network, let's look at the list of network doctors and hospitals, because there's no point in changing into an insurance plan that doesn't cover 2/3 of your doctors.
That makes sense. So a couple of points, because I just want to make sure. I mean, I know what they are, but just for the, I guess, the layman, so to speak, to define a couple of things. So like a deductible. So how would you define a deductible?
It's the amount of money that you have to pay out first before the insurance company pays anything.
Okay, and a copay.
A copay is a set dollar amount that you would pay for specific services such as office visit or prescription drugs.
Okay, and coinsurance.
Coinsurance is just a fancy way to make it take a little bit longer to get from the deductible to the out of pocket.
Okay, and a premium.
A premium is the amount you have to pay every month, regardless of whether you use the insurance, in order to keep the plan into place. Just like you pay for your car insurance, that's actually a premium as well as you would have on your health insurance. And that does not contribute to your deductible or your out of pocket. It's just what you have to pay to maintain the insurance.
Okay, and the most important one, in my opinion, because in that Adams Ruins Everything episode, in network and out of network, because he made a joke about if you're sick and dying, you don't have a way to choose an in network, out of network doctor. So what's in network and then what's out of network?
So let's go down the sick and dying. So if you have an emergency, let's think you're having a heart attack. It doesn't matter whether they're in network or out of network. Go to the nearest emergency room. If you think you're having a heart attack, you've gotten a severe injury, you could be bleeding to death, something major, that your life is first. And the federal law, actually there is a law, it's been on the books for over 20 years. Emergency services have to be covered in network regardless, whether they're in network or out of network. In network means that the doctor, hospital, labs have a contract with the insurance company. Sometimes it's HMO, but usually it's a PPO, which is a preferred provider organization. It's a type of network. And the doctor, they're contracted. So you go to see your primary care physician and they have and that's usually a general medicine or internal medicine doctor. For children, it's a pediatrician. They have a contract with your insurance company. And let's say they charge $200, but the contract with the insurance company says they're going to get paid $150, and you've got a $25 copay. You're going to pay $25. The insurance company is going to say, okay, your contracted rate's $150. The patient paid $25. We're going to pay you the other $125. Because of that contract, it's illegal for that doctor to bill you anything over and above the contracted rate.
Okay, and I think those are really good things for people to know, because I think they don't really understand those things in general. Especially, I remember when I first got in insurance, when I first got a job, and I didn't understand what any of that stuff meant. So I think I have about 3-4 questions left that I want to cover. And so the first one is, as far as the coronavirus's effect on health insurance right now, because in the news it's been out there of whether your insurance will cover you or not, or they won't cover your treatment, but they'll cover the test. What is an update you may have to help people kind of understand that with insurance?
So the insurance companies have met with our federal government, our president, and they have all agreed to pay for the testing 100%. So that's the test to find out whether or not you have the coronavirus. They then can charge you your deductible, copays, whatever, for any care you might need. So if you get the coronavirus and have to go in the hospital, you are still going to be responsible for your deductibles, your copay, your coinsurance, your out of pocket. That's not getting covered 100%. It's getting covered just like any other illness. It's just the testing is being covered 100%. Now, the federal government is also covering testing for everybody, whether you have health insurance or not right now, to find out if you have the coronavirus. Another thing, and this is such a great thing, telemedicine, or what we call telehealth, teledoc. It goes by a bunch of different names. That means you can call in and talk to a doctor. All the insurance companies, even those with Medicare, that has now been added. The federal government has gotten that added to all of the policies now. Anybody that has health insurance, telemedicine is being covered. Telemedicine is what I call an urgent care on your laptop or smartphone. Instead of you having to go sit in an office and get sicker. So here's my favorite example. Let's say I have a sinus infection and I want to go see the doctor to get treated because I need to get an antibiotic. Now I'm not going in and sitting next to somebody who may have the coronavirus and catching it. I'm just getting treated for my sinus infection, doing the drive-through at the pharmacy and picking up my antibiotic and coming home. So it's a huge thing to use it. Most insurance companies already build it into the plans. So if you have health insurance, call your carrier, go online, check it out. You may have a zero copay, you may have a $10 or $20 copay, but yes, telehealth is available. If you don't have telehealth, agents like myself can help you get it. We have a couple of companies that sell it. I've got a plan that's $20 a month for you to get telehealth. Even doctors that do not have telehealth aren't set up. So let's say you still want to talk to your primary care. The president announced today that under HIPAA, which is the Health Insurance Portability and Accountability Act that was passed in 1996 by Congress, that they are not enforcing HIPAA laws so that your doctor does not have to have some special program. He can just Skype with you and talk to you now and treat you. The doctors don't want to get the coronavirus any more than you do. So if you can all, please, please, please use the telehealth programs and get treated, that is incredibly important because it's going to greatly reduce the spread of this virus that's going around. Just to give you a personal story, someone I know, a client, was trying to use telehealth yesterday and spent quite a few hours on the phone trying to get through because everybody's going to it because the primary doctors, the urgent cares, the emergency rooms, they really don't want to see you. And actually the emergency rooms will see you if you've talked to your doctor and they feel that it's coronavirus. They will then refer you to the emergency rooms for the testing.
That's super
They
solid.
they want you to stay home.
I understand.
So here's one of the things I'm going to tell y'all. If you have a telehealth program through your health insurance company, those are available 24 hours a day, 7 days a week. If it's a 2-hour wait, call back at a different time, 6 a.m. in the morning, 10 o'clock at night, just try a different time. They're trying to get back out to you as quickly as they can. And because of the fact that doctors just aren't even seeing patients in their office right now. And I don't blame them. There's already several reported cases of doctors not only contracting it, but getting sick. Massachusetts has a hospital where 164 employees have been sent home from the coronavirus and they're being quarantined.
My goodness. Wow.
We really don't want to get our healthcare professionals any sicker than we have to. And I mean, literally, they need hazmat suits to treat you now. So I would really, I'm just going to encourage and be the voice of, thinking about this from the reasonable side. use that telehealth. That is going to be the biggest thing. Talk to your insurance agent if you have one and you've never used telehealth. Call the insurance companies. They are all about it. They will definitely help you get there. And more than anything, most of us have online access to our insurance carriers. Go to your portal, your online access, because the directions and how to get the link to get to the telehealth is listed on their websites. So you don't have,
Go ahead. Go ahead.
I was going to say, you don't have to sit on the phone all day.
No, the information you're providing is really good. And so, like, if they were looking for, like, are there specific websites or links for those things, or they just need to directly contact their provider, like you said?
So most insurance companies include it with your health plan now, and you can go straight to your website like you would log in to look at anything else on your health insurance. Let's say you're going in because you want to see what medical bill, your bills are paying through, if you got an authorization or what your benefits are. In there, look for their telehealth program. It's going to be listed and there'll be a link. And just like you and I are chatting now, you can video chat with your doctor. And they treat things other than just illnesses, sinus infections, urinary tract infections. They'll treat allergic reactions. My son had a rash. They've treated rashes over the phone and called in prescription creams. So if it's something that, excuse me, doesn't require stitches, it's not a broken bone, it's not life-threatening, please use the telehealth first. That's going to greatly, greatly reduce our exposure and chances of spreading this coronavirus. I can't tell you how important that is for people to use that service.
Well, I thank you for telling people to use those services. So what's the way that people could contact you? Like, what are emails, websites, phone numbers? What's the best way for someone to get in contact with you if they wanted to get more information?
Our website is carolinahealthconnections.com. Our office phone number is 704-512-0600. We do service and help people in both North and South Carolina. Those are the two states I'm licensed in. Probably the best two ways is that. On my website is a portal. If you have questions or want us to call you back or email you, you can just key in your information and one of my team will get back to you, usually within a few hours, 24 hours at most. But we will reach back out to you and help you.
That's excellent. So when I wrap up with people, I love for them to have the final voice. I named the podcast Voices of my brothers, sisters, and people, specifically because I want to highlight the voice of other people, because their people have valuable information. So for the final word, I always leave it to the contributor, specifically to talk about what they were talking about in the actual recording or anything that's on their heart. So with that, I'm going to say thank you to you, and then I'm going to leave the final word to you.
Thank you. I really appreciate this because we need to get the word out. We need to keep people home. And I'm going to go down the coronavirus path because this is a very serious illness and people keep asking me all the time, I don't understand, why should people be working from home right now? Just like you should be working from home, they've closed the schools. Children have a high resistance to this, but children are the biggest carriers of this. So they get this coronavirus and then they're transmitters. They're little receptacle transmitters. And the teenagers, and I know they're going to battle with you about staying home. They need to stay home. Keep your distance 6 feet away from anyone else. So if it means pull out the board games and have game night at home, and just be conscious of the fact that the more we keep our distance from others and reduce the spread, the quicker this will be over. It's the not keeping our distance. It's thinking we can go out to eat. And the governors, North Carolina just shut down the restaurants. They're not allowed to have any open dining, any bars open. It's takeout or delivery only. Just be considerate of everyone else and stay safe. And just think about it. I don't want to get the illness, just like I don't want to get the flu. If we took half the measures for the flu that we're taking for the coronavirus, we would see a lot less deaths in the flu. And in 2019-18 year, we had 18,000 recorded deaths from the flu. Let's not make the coronavirus that, and let's try to gain some control and stay safe.